Future Surgeons with Professor Dr. Zahid Mahmood. Welcome to the Surgical Learning Series with Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College. Let us master today's important SEQ, simple, focused, and exam-ready.
I am speaking on behalf of Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College, Lahore. In this series, we will cover important SEQs from UHS past exams. These are high yield for your professional exams and essential for clinical practice. SEQ 16. A 12-year-old boy is brought after a road traffic accident. He has a forehead laceration with bleeding. He is fully conscious. Answer. First step is primary survey and resuscitation. Airway, breathing, and circulation. In this case, apply pressure dressing to stop bleeding. Next plan, secondary survey, X-ray skull and cervical spine. Primary suturing of wound. Definite management. Give analgesia and antibiotics. Tetanus prophylaxis. Primary suturing with Proline under aseptic measures. Monitor with Glasgow Coma Scale. Follow up in 5 days for stitch removal. Closing. Always write your answer as first step, next step, and definitive plan. SEQ 17, branchial sinus or fistula. Case SEQ 17. A 6-year-old girl has a discharging sinus on the right side of the neck, just in front of the sternocleidomastoid muscle. It has been present since birth. Answer. The most likely diagnosis is branchial sinus or fistula. Relevant investigation, sinogram or fistulogram. MRI may also help. Treatment. Complete excision of the sinus or fistula tract. Often requires more than one transverse incision under general anesthesia. Closing. Always mention both investigation and surgical excision in your exam answer. SEQ 18, squamous cell carcinoma, lower lip. Case. SEQ 18, a 60-year-old farmer has a non-healing ulcer on his lower lip for 4 months with a 1 carrying 1 cm or swelling in the neck. Answer. Most likely diagnosis is squamous cell carcinoma of lower lip. Investigations, incision biopsy of lip ulcer. FANAC of neck node. CT scan of head, neck, and chest. Management. Small tumors, wide excision with primary closure. Intermediate tumors, V or W excision with flap reconstruction. Large tumors, total lip reconstruction, often with forearm flap. Advanced cases may need neck dissection with lip excision. Closing. In exams, structure the answer, diagnosis, investigations, and options of surgery or radiotherapy. SEQ 19, risk factors for wound infection. Case. SEQ 19, enumerate the risk factors that make a wound more prone to infection. Answer, important local factors, site of wound, type of injury, incision or crush, contamination with bacteria or foreign body, loss of tissue, poor blood supply or previous radiation, systemic factors, malnutrition or vitamin deficiency, diabetes mellitus, steroid therapy or chemotherapy, immune deficiency states, smoking. Closing. In exams, always divide the answer into local factors and systemic factors. SEQ 20, ranula, young cricketer. Case. SEQ 20, an 18-year-old cricketer has a slowly increasing bluish swelling under his tongue for 6 months. It is fluctuant and displaces the tongue. Answer. The most likely diagnosis is ranula. Differential, retention cyst, or minor salivary gland tumor. Management options, marsupialization of cyst, excision of cyst with sublingual gland. Rarely may disappear spontaneously. Never do incision and drainage, as recurrence is common. Closing, always write diagnosis, differential, and clear management options in such SEQs.
You have been learning with Professor Dr. Zahid Mahmood, Professor of Surgery, Lahore Medical and Dental College. For more SEQs and surgical tips, subscribe now and join us again for your next step toward exam success.